And who cares about all the collateral harms from the things I'm supporting? For me, all that matters is how many COVID people get COVID, how many people die from COVID. And so I'm going to do everything in my power to make sure that. So the mRNA platform, which it really wasn't quite yet ready for prime time, we're going to, like, within days of January 2020, there's a vaccine target at the NIH. There's a strategy of using the mRNA platform in order to, like, develop and deliver a vaccine within like, I think it was like January 10th or something. I forget the exact date, that you have this vaccine target available inside the NIH. There's a video of Fauci go like touring a lab at the NIH, bragging about the mRNA platform and how fast they developed this vaccine for this as soon as they got the sequence for the virus. And then the lockdowns. Well, I mean, how do you, if the vaccine is going to save everybody, and so then Fauci and the NIH can look like saviors, you have to get to you still have to test the thing. That means you need to try to suppress the spread of the disease as much as you can until you can get to it, right? And, if you have a technology to stop the spread of it, it's a deadly disease, especially for older people. It's of course right to use it, as long as the benefits of that are as long as the harms of that don't outweigh the benefits of it, right? But if you take that kind of logic, you would never have closed schools, because the harms to the children outweigh the benefits to the children from this. So you can't have that logic. Instead, you have a logic of, we have to reorganize all of society around the principle of stopping the spread of this one disease. And so you can put forward principles like Swiss cheese, where you don't have to evaluate any particular slice of the cheese. Cloth masks, oh, no problem. It might work, so why not just use it, even if they have lots of holes? Closed schools, okay, it might work. Why not just use it, even though it's going to harm a lot of kids and not actually particularly protect teachers or children, teachers or children, or even grandma from it? Lockdowns, all of that. Send COVID-infected patients back to nursing homes. Why would you do that? Well, because you're not thinking about protection of elderly people. You're thinking of keeping hospital beds open so that you can treat COVID patients so they don't die of COVID, even though they did die of COVID in large numbers and early on, because they mistreated them with ventilators and remdesivir or something. So you have essentially all of the alignment of incentives for Tony Fauci to try to suppress the disease itself, while completely ignoring all the collateral harms, and actually even ignoring the problems with the efficacy of the slices of Swiss cheese that he was putting forward. Because it doesn't matter, as long as it's positive, the marginal effect is positive. That's all that matters. It doesn't matter what the harms are. Ultimately, everyone's going to get COVID because we have no technology to stop it. That's the reality. But he doesn't care about that. All he cares about is like, let's delay until we get to the vaccines.